What we're going to talk about tonight is the truth about plastic surgery, and we're going to emphasize sort of lunchtime procedures like Botox and fillers and mini lifts. We will show a few examples of probably more invasive procedures, but we're going to try to talk about what I call lunchtime treatments. We started this series a number of years ago basically to teach people about the truth about plastic surgery as I see it. And we've got many patients who have given us permission to use their images. We show diagrams and some anatomic sketches, etc. There's lots of misconceptions on the internet and even in common advertising about what plastic surgery can do and what it can't do, etc. So I'd like to give my perspective, the truth about plastic surgery. And again, thanks very much for coming. I do want to say that we're going to have time afterwards for questions. I can't do individual consults, but you can sign up. I think there's one courtesy. You get a consult for attending. But if I say something that's not clear, please let me know. Okay, so first of all, people say to me, Dr. Morwood, why do they call it plastic surgery? Is it because you use a lot of silicone or plastic in your work? Actually, the root of plastic, plastiko, in Greek means to mold and shape and tailor, and that's what we do in this specialty. Sometimes people come in and they say, oh, Dr. Morwood, I feel kind of vain, and I know you do a lot of breast cancer and operating overseas on children, and you do a lot of serious cases, and I feel maybe I shouldn't worry so much about how I look. The truth is that it is in our DNA for men and women we want to look our best. It's just ingrained in us. It's in our chromosomes. In fact, when we see someone on the street who's not concerned about their appearance, we recognize that something is a kilter. So it's perfectly normal, natural, healthy to want to look your best. This is perhaps the most important slide I'm going to show today, and it isn't even a before and after picture. So this is what I call the triangle of beauty. When we talk about facial rejuvenation, I like to talk about a triangle on top of a foundation, and the triangle has three parts. First of all, it's skin texture. That's the surface of the skin. Fine lines, dyspigmentation, sunspots, some people call them liver spots, etc. Then there's volume. One concept I want to teach you is that as we mature, we lose volume in our face and in our hands, and we gain that fat in our trunk. It's an unfunny practical joke, but that's just what happens. With hormonal changes for both men and for women, we lose fat in the hands and in the face, and we put on the fat in the trunk. Now later when I talk about fat grafting, we're going to learn how to take advantage of that process. But for now, keep in mind that part of the significant aging process is a loss of volume in the face. And what that does is allow gravity then to pull down, especially pull down face almost into the neck, deflate the cheeks, etc. Now, the soft tissue transposition with time, to reverse that, that's what most people think of as plastic surgery. Making incisions, redraping skin, tightening skin, removing skin, sometimes tightening up the muscles, etc. So the triangle lies upon a foundation. The foundation really is the cranial facial skeleton, the chin and the nose and the cheekbones, the orbits. There are actually changes in the cranial facial skeleton as we mature, actually quite dramatic changes. So sometimes we affect those. Sometimes we sort of disguise the changes with volume. But please keep this in mind. The triangle of beauty, facial rejuvenation, the skin and volume, and the soft tissue position and transposition on top of a foundation. So accurate and high quality plastic surgery starts with an accurate knowledge of the anatomy. This is the skin. The epidermis is what we see. That's the very superficial layer. Underneath that is the dermis. Now the dermis is very important because that's where the collagen is, that's where elastin is, that's where hyaluronic acids are, that's where the blood supply is. The dermis is on top of the subcutaneous tissue, that's the fatty layer. Then there's a layer of fascia on top of the muscle or sometimes within the fat. Fascia is connective tissue, it's like collagen. It can be very thin and wispy, like wet tissue paper, or it can be very thick and heavy like a leather belt. And then of course there's a muscle. Overlying the bone is the periosteum, then there's the bone. Okay, so this is a very busy slide. But the reason why I'm showing these slides is that with aging, we can see changes in every layer. And everyone ages differently, depending upon your DNA and your chromosomes, and if you grew up in Alaska or London or grew up in southern Florida, how much time you spent in the sun, how often you went to the beach, your diet, your exercise regimen, etc. So I talked a little bit about what's in our DNA to want to look our best. Also it's just built into us that we can look at this woman and we know that this is, you may not recognize it as her, but you know that this is 50 years later. There's volume changes, there's skin changes, there's changes in the skin, there's changes in the position of the skin and the craniofacial. Hi, come on in. We have plenty of seats. Thanks for coming. So, once again, to go from here to there, that is the same person, but you'll see changes in what I said. Remember the triangle of beauty. The skin, volume, that surface of the skin, the volume of the face, and soft tissue position on top of the skeleton. So, every patient deserves a custom designed approach, and that's because everyone ages differently, everyone brings a different face to the office, everyone brings a different set of chromosomes, etc. This is not the kind of practice where it's a cookie cutter approach and everybody gets the same thing and you don't meet the surgeon until the day of the surgery, etc. Everybody meets me and we do the Vectra. I'll talk about the Vectra, the computer and analyzer, etc. So, once again, skin texture, volume, soft tissue position and transposition on top of the foundation. So, everybody in California, one of the reasons we live here is because we love the outdoors and the sun feels so great. However, the UV rays in the sun plays havoc with the skin. So we all need to learn to take care of our skin. Number one, we could talk about this, of course, for an hour, but I just want to go through it quickly. Number one, avoid the sun. Even though it feels great, it's not good for us. Number two, you need to learn from a plastic surgeon or esthetician or dermatologist to properly cleanse your skin. Some people have oily skin, some people dry, some people have patches. Exfoliation. Remember I talked about the epidermis? The very top layer of the epidermis is called the keratin layer. That's like nails and hair. It's not living. And when that layer gets too thick, the skin loses its sheen and loses its ability to reflect reflect light. Some more visitors? Come on in. Plenty of seats. Come on in. So we're talking about skincare essentials. Thanks for coming. Just mosey on in and make yourself at home. Thanks, Angel. Oh, did everybody meet Angel and Heather up front? And that's her real name. I say our wonderful office angel. Okay, so we're talking about skincare essentials. Number one, avoiding. I'm going to back up one slide for our guests. So everybody here loves the outdoors. That's part of why we come to California. But the sun is not good for us, good for our skin, the UV rays. So I was at exfoliation. The epidermis, the very top layer of that is called the keratin layer. It's thick. If it gets too thick, or I should say it can be thin, but if it gets too thick, the sun loses its sheen. It has a dull appearance, etc. And it's not living. It's like hair and nails. Restoration. This is vitally important. In the germinal matrix, or where the new baby cells are made, we can actually increase that little factory that makes baby cells. So the cells replicate, and it takes about 30 days for the baby cell to get from that layer up to the top of the skin. So you can see it. It's not sun damaged. Now, sometimes I hear people say, oh, Dr. Morwood, I tried skincare for 2 weeks, and it hasn't really done anything. Well, I want you to know that you haven't even given yourself a chance for one cycle or one turnover. So if you hang in there for at least 30 days, and then you might hang in there for 6 cycles, 6 months, you can actually improve the health of your skin. Moisturizing is very important. Sometimes people come in and they think that they just have tons of fine lines or crepey skin, or especially around the eyes or the lips. Actually, it's dried out skin. And probably, I put this as number 6, but probably second only to avoiding the sun is avoiding smoking. Everybody's heard about antioxidants in cranberry juice and blueberries, etc. Well, cigarette smoke has tons of oxidants. It's almost like a rusting factor for the microvasculature. So here's an example of a skin biopsy, and I want you to know that plastic surgeons and dermatologists can actually take little skin biopsies and study them to say, okay, what's working? Is laser working? Are fillers working? Is this vitamin C prep working, etc.? And so after 6 months of skincare, you'll see a thinner keratin layer, you'll see a thicker dermis, more collagen, more orderly collagen, etc. Now, I'm showing this because we're talking about skin. And sometimes people will think that laser is the answer for everything. But keep in mind the triangle of beauty. There's skin texture, there's volume, and there's soft tissue position on top of the foundation, right? And I'll be coming back to that triangle of beauty if people weren't here when I first brought it up. So this is sent to me by a friend of mine, before and after laser. Now, that's good for the skin texture. Certainly, it is good, but it's treating that one corner of the triangle. That's the skin surface, the skin texture. It has not made the skin dramatically tighter or redraped the skin or removed any skin. Now, when people say sometimes that they want to have a laser facelift, I'm showing this to make a point. Laser is an energy that when it hits the skin becomes heat. Regardless if it's an argon or a YAG laser, etc. It essentially becomes heat. Now, everybody knows what bacon is, even if you don't eat it. You take it out of the package, you could tie a knot with it. It's supple and moist, etc. Certainly, when you heat it, it shrinks, 100%. But it becomes very brittle. You can snap it. You can't tie it in a knot. The point is that if you laser your skin so much to the point where it's starting to shrink, it's going to lose its resilience, going to lose its moisture, etc. Now, I'm not down on laser, but it's treating one part of the triangle. There's 3 parts of the triangle on top of the foundation. So the reason I show this, my staff found this for me on the internet. When the only tool you own is a hammer, the whole world looks like a nail. So I'm not opposed to laser. I like TCA peels and croton oil peels personally, but that's treating the surface of the skin. A facelift doesn't erase wrinkles any more than a laser will dramatically tighten your neck, etc. Now, I do want to show you the TCA peel. This is something that I like. I have much more control with the TCA and a croton oil peel than I feel like I do with a laser. So, if you schedule a consultation for facial rejuvenation here, we will try to remind you to bring in photographs from your 20s and 30s, or even baby pictures, and then from your 40s and 50s, etc. Because I love to study how the face is maturing, especially with the fat compartments. So here she is, and there she is about 50 years later. Let me back up. There's been changes in the skin surface. There's been changes in volume, and there's been changes in soft tissue position and amount. So I think the next slide I'm going to show, my wonderful office staff has warned me. Oh no, the next slide is her. Okay, so there she is. Now the next slide shows her about a week after treating her skin. Now I did keep in mind for the triangle, right? Triangle of beauty. So we did some perioral scrubbing, TCA peel, conservative revolumization, and skin redraping. So we go from there to there. Now, I do want to, now, my wonderful office staff has told me that everybody in the room is not accustomed to looking at post-op photos. So here she is about 1 week later. Okay, so what happens with a TCA peel? Nothing really happens for 5 or 6 days. And then for 5 or 6 days, you shed dramatically. And then you have pink skin that's smoother and finer. And it takes about 6 to 8 weeks for that pink skin to fade. And you can hide it with makeup. So you're up and around, 2 weeks later. But you probably would wear makeup. But you can see that it's a nice kind of rejuvenation for the surface of the skin. Now, here's a gal. Now, if you picture her losing volume. Let's say we have a very tight water balloon or air balloon and we let a little bit of the air out of it. Remember I said we lose volume as we mature? So the very tight air balloon or water balloon just kind of sags just a little bit, right? So there she is with some conservative skin redraping, a little revolumization, and there's about 5 or 6 days after the TCA peel, maybe 6 or 7 days after the TCA peel. And there she is about 8 weeks later. Okay, so I hope you're starting to get the idea that when we address the 3-corner triangle and we go step by step, I mean most of the time the same day, but when we address all 3 corners we can get a much more natural look. So we're not pulling really hard on the skin to try to get every last wrinkle out, etc. We're treating the wrinkles with volume and, in this case, a TCA peel. So a lot of times people come in and ask me about the lines around the lips. Women call them cigarette lines or smoker's lines, and they say, I tried not using a straw for a long time and it hasn't gone away. Actually, it's kind of a difficult problem because the issue is a loss of volume and a degeneration of the skin surface, and also like a piece of paper. If you fold the paper back and forth 1,000 times, eventually, when you stop folding, there will still be a crease. And that's really what a ridded or fine line is. So there she is after peri-oral dermabrasion. We're kind of really scrubbing, sanding. Not perfect, but much improved. And a little bit of revolumization. Sometimes, let me back up for a moment. Sometimes I'll do micro Botox around the lips. Now, when I say micro, I don't like to change anyone's smile, especially for women. We want you to be able to move your lips. I don't want you to look frozen. It's great around the eyes. I'm much more, maybe, I don't know if aggressive is the term, but I'm much more liberal with Botox around the eyes. Around the lips, I'm very, very judicious and careful. But it can help minimize the lines. Okay, so I want everybody to see this that I've shown about 4 times. This is the triangle of beauty. We talk about facial rejuvenation. Skin texture, that's what we see. That's fine lines and pigment changes, etc. Volume, as we mature, we tend to lose fat in the face and in the hands, and we gain that fat in the trunk. It's an unfunny practical joke. And then the soft tissue can sag and move and lose its resilience, etc. So affecting that's mostly what people think about for plastic surgery. And the triangle of beauty is on top of the foundation. That's the craniofacial skeleton. So the reason why I showed this was one of my medical assistants' kids. You know, people notice, you see a baby with those big chubby cheeks, even if they're normal weight, and you want to go up and pinch the cheeks, the incredible amount of fat, subcutaneous fat in a baby's cheeks is amazing. And as we mature, we tend to lose fat in the face and in the hands. We put that fat on in the trunk. There we go. As we mature, we tend to lose fat cells in the face and hands and gain them in the trunk. That unfunny practical joke. So, I talked about skin. I mentioned lasers. I mentioned TCA peels. I mentioned croton oil peels. What about that second corner of the triangle? Volume. All important volume. There are 2 big ways that we treat volume loss in the face. One is with fillers, and the other is with your own fat. So very briefly, and again, we could talk about any of these topics for 4 hours. You know, plastic surgeons, we go to these meetings and we talk about fillers and we argue about the best filler and how to use it for 4 hours, and it goes on and on and on. And fat grafting is the same way. So what about fillers? Fillers come in a syringe. Most of the fillers I use are hyaluronic acids. You've heard of them, Restylane and Juvederm, and I like Voluma, and the newer one is Belotero. There are also some calcium-based fillers like Radiesse. There are some semi-permanent fillers. I don't use them a lot, like Sculptra. So they come in a syringe. It's sterile. It's on the shelf. You come in on lunchtime. We numb you up. We can give you higher cheekbones, advance the chin a little bit, sometimes minimize a line or wrinkle. That's not my favorite way to use fillers, but it's a revolumizer. And I'm emphasizing this a little bit because it's different than Botox. And I'm going to talk about Botox. So Botox is a muscle relaxant, which is different than filler, which is a volumizer. Okay, so far? Now, the other way that we can revolumize someone's face or breasts or buttocks, etc., with a person's own fat. Remember, I've said, I know I'm wearing you out, but we lose fat in the face and in the hands, and we put the fat on in the trunk. Well, we can do conservative liposuction in the trunk, usually from the flanks or tummy. We can negotiate that. And we decant the fat or spin it down, centrifuge it, sometimes process it, keep it sterile, and then we can re-inject it for the cheekbones, bring the chin forward, pre-gel sulcus, sometimes the Angelina Jolie look, and Brad Pitt to have that really strong posterior corner. We call this the mandibular angle. Sometimes for the glabellar area, the temples, etc. And I also do it in larger volumes for the breast or for the buttocks. So That's the difference between fillers and your own fat. Now, some people say to me, well, how long does it last? About 67% of the volume we transpose takes root. It's you, it's your cells. And in fact, if you gain weight, you gain weight with the grafts as well as all over. And if you lose weight, you lose weight all over. They're living, breathing cells. It's you. Unlike a filler, hyaluronic acids like Juvederm and Belotero, the old collagen, etc. Those are temporary. It could be up to 2 years. Now, you might say, well, why doesn't everybody just do fat if it's permanent? Well, it's a mini surgical procedure. Filler is a lunchtime treatment. You can come in and have it done lunchtime. You might be bruised and swollen for a couple days. Hide it with makeup. No big deal. You go back to the office. Fat is a bit of a surgical procedure. We can do it here in the office. Large volumes we do with an anesthetic. But it's, we harvest fat and we process it and regraft it, etc. This is one of my favorite slides. We're talking about volume. Everybody in California knows about the grape and the raisin. You probably know about the plum and the prune. What happens with time, you've heard me say it, and volume loss. The plum becomes the prune, the grape becomes the raisin. Now, you've heard me talk, I've showed some examples of facial rejuvenation. You've heard me talk about revolumizing. This is lifting and filling. It's what I call volumetric facial restoration. Lift and fill. Instead of just pulling skin so tightly that you've seen maybe somebody in Beverly Hills who's had 4 or 5 facelifts or more. Now this is Northern California. This is the Central Coast. We don't like that look. So let's lift and fill, revolumize. Okay? Now, instead of like, if we wanted to take the raisin and make it a grape again, we wouldn't want to stretch the skin so tight and cut off the extra. We'd probably want to maybe tighten the skin, but we'd want to revolumize, okay? Here we go again with that all-important slide. So I'm showing this because these concepts about volume and skin and soft tissue position, it's true all over the world, regardless of your ethnicity. It's true for men and for women. High cheekbones, whether you're a man or a woman, high cheekbones are very attractive. Strong chin, strong jaw, etc. So here's a gal who came into the... So I'm going to show some lunchtime treatments because I've been talking about fillers and I've been talking about skincare, etc. So here's a gal who thought that her high cheekbones were sort of involuting, kind of getting smaller as she matured. So in the office, we had her on skincare. We did some fillers for the cheekbones. We did a mini lift to go from there. So if we see, she's more sort of square-faced there. And then now she's more heart-shaped, right? So we shift volume up just a little bit, treat her skin, and revolumize, etc. Mini lifting. So here's a gal. She did some modeling. She felt like, again, as she matured, she was losing her high cheekbones, really gorgeous eyes, but she wanted more volume. So this is in the office filler. I can talk about fillers for an hour. They're categorized by what they're made of. Most of the ones I use are the hyaluronic acids. Then we go by the G value. It's really how thick they are. Voluma is thick, lasts for about 2 years. It goes right down on the bone. Belotero is really fine, almost like an oil. I can use it under the eyelids. It doesn't last that long. So for this gal, got a high G value filler to help restore her cheekbones. So we go from there to there. Okay, let me back up. So we go from there to there. Okay, so that's done right in the office. So when I talk about lunchtime treatments, mini lifts, you've got to rest and take it easy for 3 days and 3 nights. Fillers, you can go right back to work, etc. Okay, so what about fillers? Here's a gal who came in and she felt her lower eyelids looked tired. She wasn't ready for surgery, and I didn't think she was ready for surgery anyway. So think of the lower eyelid. It's a little puffy there as a hill. And then we have a valley. And then we have a mountain, which is the cheek. So we have a hill, we have a valley, and we have a mountain. What we can do is elevate the valley a little bit with a filler or fat. Instead of bringing down the hill or bringing down the mountain, why don't we fill up the valley to revolumize? So in the office with filler to what we call the tear troughs, those grooves underneath the eyelids, we can inject those in the office. Okay, it's sort of in a way it's sort of a disguising maneuver, but what it is restoring the volume she had even 5 years ago. That's filler. In the office, it comes in a syringe. We give people blocks, like dental blocks. We make you numb. It's sterile. We need to use a needle, but we make you numb, etc. As opposed to fat grafting, where we do a little conservative liposuction, spin it down, and re-inject it somewhere else. All important triangle of beauty: skin texture, the soft tissue position, volume on top of the foundation. Okay, so I've talked about fillers. I've talked about TCA peels. I've talked a little bit about laser. What about Botox? Botox is different than a volumizer. Botox is a muscle relaxant. The muscles underneath the skin in the face attach to the skin. So when the muscles contract, it's like an accordion. It's moving the skin. That's how we make expression and to some extent say our words and blink and raise our brows at somebody, etc. So it's a muscle relaxant. It started as a medical treatment for children with cross eyes and exotropia, esotropia. The pediatric ophthalmologist would inject it into the eye muscles. I did this over 25 years ago for children with facial asymmetry when I was a fellow at Children's Hospital in microsurgery to help balance out the face. It's a muscle relaxant. So I like it around the eyes especially. We can give somebody a little bit of an improved shape of the brow. We can elevate the brow a little bit. We know that there are three major depressors of the eyebrow: the procerus, the corrugator, and the orbicularis oculi. And there's one major elevator, that's the frontalis muscle. So if we selectively get the depressors to relax, and then we let the elevators take over, we can lift the lateral brow, the corner of the brow, we can help reshape, etc. So, for example, here's a gal who works with the public, and she came in and she said, my coworkers think I had a bad night, or I broke up with my boyfriend, or I'm upset, or I'm angry. And she was a happy-go-lucky girl, and she just wanted to relieve this look of consternation or concentration or sort of look of disapproval. So here she is in the office on day one, and I gave her Botox, and I asked her to come back in 2 weeks, and there she is trying to make that same expression. So it's really effective, especially for the glabella is between the brows. It works very well around the eyes, but I'm very, very careful, judicious around the lips. Now, I can show you a lot of these. I don't want to bore you. So same thing for this gal. She felt like when she was at her desk a lot reading, she would be sort of straining, and then eventually she'd get a headache, etc. So much more relaxed look, kind of a relief. Here's a gal, I think I treated a little bit into her foreheads and into the glabella. Now, sometimes what we do, if someone has a crease even when they're at rest, that's when we sometimes combine the Botox and the filler. So the Botox can help the muscle relax, and the filler can help restore the volume. And actually, for some of these fillers, if we study the skin, like do a little skin biopsy, they can actually result in more hyaluronic acids in the dermis, more collagen, etc. So sometimes what we'll do is a combined approach. I'll do the Botox to get the deep line to relax. If someone wants more improvement, then I can use a filler. Okay, so I talked about fillers. I talked about Botox. Now what about fat grafting? Fat grafting is a way we can restore volume. We can help shape things after surgery a little more. It's a natural filler. Now what about stem cell rejuvenation? We don't use the phrase stem cell facelift when we're board certified. We're discouraged from saying that because 1 out of 176 cells that we transpose is a stem cell. We certainly bring up some blood supply. We bring up estrogen receptors that can improve the skin. We bring up some stem cells, but a lot of it's volume. And I talked about the grape raisin principle. So here's a gal who wanted to maintain a natural look, but she just wanted to look more refreshed. So by revolumizing, primarily with her own fat grafting and some conservative soft tissue repositioning. So there she goes. And what we aim for is, of course, a natural look. We don't want people to look stretched. Now, here's a gal who you can look at her, and once again, if you think of the balloon that you let a little air out of, she looks a little bit deflated. So if we treat her skin, if we do conservative soft tissue positioning and some volume restoration to get more of a natural look. So the reason why I'm showing this case is because with revolumization, oftentimes people will get the if that's my manager, tell him tell him I already have a gig tonight. Um, so with this gal, we looked at her photos from years ago, and with revolumization, after we did that in conservative soft tissue positioning, she got more projection. And remember I talked about the models, whether you're a male model, female model, it's definition, and it's really she almost looks wider. You see that? But more vibrant.
That was
Fat repositioning, yes, and a little bit and proper skin care and conservative soft tissue repositioning. Mostly repositioning instead of removing, stretching and removing. Now, one of the places where fat grafting works great, some of the women here know what submalar hollowing is. Below the cheekbones, some women, some guys start to lose volume and they almost get little dimples in the cheeks. Fat grafting is almost ideal for that because we can do that in the office. We do a little conservative liposuction, spin the fat down, re-inject into the cheeks, and she goes to there. Okay, so by now you've probably all memorized the triangle of beauty: facial rejuvenation, skin texture, volume, soft tissue, transposition on top of foundation. So, how are we doing so far? Are we okay? I guess we've been going for about half an hour, maybe 15 minutes more. Do that, Heather? Is that okay? Okay, so a little bit about surgery. I show this slide because, like most plastic surgeons, I divide the face into thirds. The top third is really the brows and the upper lids and the forehead. The mid-face, the lower lids and the cheeks, including the lower cheeks. Now the lower third of the face essentially is the neck and jowls. So it used to be that somebody would come in and you'd either get a complete facelift or nothing. Well, nowadays nobody knows what a complete facelift is. You can just tell me you just want your eyes done, you just want your neck done, you want to revolumize your mid-face, etc. So here's a gal who's got really beautiful eyes. We elevated her brows, very conservative eyelid surgery. She didn't need her whole face done, but just to give her upper lids and eyebrows a little more vibrant look was just what she needed. So here's a gal who felt like her crease was becoming hidden in her upper lids, so conservative trim of the skin, very conservative trim of the fat to just show off her upper lids. And it even gives her eyebrows a little more vibrant appearance. Here's a gal, nice skin, but she loves to go outside. She just wanted to have a lighter look for her upper eyelids to go to there. Now here's a gal who has really nice skin. The lateral part of her brows have descended just a little bit. Her upper lids are heavy. So through the eyelid crease incision, I did the upper lids. Through a little incision in the hairline and the temples, we elevated the lateral brow just a little bit. Okay, so what about the mid-face? The mid-face is where we're most concerned with volume. And the mid-face is where I'm very reluctant to pull on. We don't want to flatten the face. We want to have definition, right? We've made that point. We want to have a face that's defined and projecting like high cheekbones. Now, here's a gal. She wanted something done in the office. So really, it almost looks like she has a lot of extra skin, but she doesn't have a lot of extra skin. She's lost volume and it's just shifted downward. So why don't we lift and fill? Lift and fill, volumetric facial rejuvenation through shorter incisions to do something like that. Just shift the volume back up where it really belongs. And instead of pulling really hard, why don't we lift and fill, redistribute some volume. So I hope you're starting to get the idea of my approach to the mid-face and replacing, I should say, yeah, replacing, like repositioning the soft tissue. So I'm showing this gal because she drove here. She drove for a couple hours, and what she said to me was she wants fillers to smooth out the corners of her mouth, the commissure lines. I said, you know, by the time we buy for you all those fillers, all those syringes, uh, and they're temporary, you might as well have a mini lift in the office to just elevate your cheeks and jowls a little bit. So she had a mini lift, short scar elevation in the office under local with some pills, some pill sedation to go to there. So this lasts about 7 to 15 years as opposed to 1 or 2 years or 6 months for fillers, etc. And it's her own tissue. Okay, so you've heard me talk about the grape and raisin. I guess what I should do is maybe get a plum and a prune, because sometimes women come in and they say, I feel like I've turned into a prune from a plum in just 5 years. And I mean, it's a loss of volume. So you've seen this photograph before. So when we take these principles and apply them from the hairline through the forehead, through the eyelids, through the cheeks, etc., we at least aim for revolumization. Her skin is fine, but we aim for revolumization, strengthening the little supporting ligaments around the eyes, removing some skin, but mostly firming, redistributing, etc., repositioning. So I want to show a few cases. Some of you have heard about the natural neck lift. So I talked about the eyelids, right? I talked about the mid-face. Now I want to talk a little bit about the jowls in the neck. A system of careful analysis. A system of careful analysis evaluating appearance, anatomy, and goals with a custom designed approach. So you recall that I said a high quality surgery starts with an accurate knowledge of the anatomy. We need to go step by step. It's just like the eyelids. There's so many different ways to do the eyelids because everybody needs something different, presents with something different. So I need to look at the skin, I need to look at the fatty layer, I need to look at the muscles, I need to look at what's going on under the muscle, etc. So the first way we do the natural neck lift is by treating the fat. Microliposculpture, what I do, I make 3 little axis incisions, one in what I call the submental crease, one where the earlobe meets the cheek on each side. And most Americans that I meet have a scar under the chin anyway because your little brother pushed you off the curb or you fell from your bike or you tripped on the stairs. I'd bet that more than 50% of Americans have a scar already under the chin. So I go right in that little submental crease, one little axis incision where the earlobe meets the cheek on each side. So as an example, this gal came in, really nice skin, overall good facial structure. However, she still had that baby fat, and she said to me that she felt that she never had a well-defined chin or neck or jawline. And so she was treated with microliposculpture, those 3 little axis incisions in the office to go to there. No skin removal, no muscle tightening, microliposculpture. It works well for guys. Here's a surfer dude. We felt that he had the baby fat remaining. 3 little, the cannula, which is what I do the liposuction with, for microliposculpture, it's almost like a needle. It's like a big needle. So I just need to make a narrow little axis incision. Usually I put 1 stitch in afterward. So let me back up. So we go from there to there. Treat that baby fat. Before I go on, some people ask me about Kybella. Kybella is an injection. It's deoxycholic acid. Essentially, it's like bile that the gallbladder stores, the liver makes it. It melts fat. It has pros and cons. The treatment usually needs to be repeated. The nurse can do it. It's certainly outpatient. So if what you're trying to treat in the neck is the fat, you can consider microliposculpture and you can consider Kybella. So now here's a gal who's very interesting. She's got some extra fat in her neck and she had a little extra skin. Remember I said custom designed approach, right? Everybody gets a different treatment. If I treated her only with liposuction, she'd have too much extra skin. So she needs some fat removal and she needs her skin redraped. Okay? So I hope you're getting the idea that everybody gets a different procedure based on what they need. Now, I'm sort of going up the ladder. right? A little more aggressive each time. Now here's a gal who needs to be revolumized. She needs some skin treatment, and she needs some skin tightened, and we need to kind of show off her neck and jawline again. So she was revolumized, TCA, this is all in one day in the OR. TCA peel, some fat grafting, and skin redraping to go to there. But we treated layer by layer what needs to be done. I think that gives the most natural results and the most effective, longer lasting results. Some of you have been to Paris or you've been to Palo Alto. This is by my favorite sculptor, Rodin. I show this because the neck lift, I think in my practice I do more neck lifts for men than I do facelifts for men. Partly because a strong chin, jaw, neckline for both men and women really is a great foundation for the rest of the face. And again, triangle of beauty, you know what the natural neck lift is. It's a system of careful analysis. So here's a guy who works out. He's vibrant. He's his own boss. He does well. And he just looks a little tired and a little deflated. So to trim up the neck like that, restore the firmness. He also wanted some conservative facial work done. In the side view, just a little saggy tissue to restore kind of a clean, trim, crisp neck and jawline. Really helps. Here's a guy who came in and he said his grandkids on the couch grab and say, you know, Grandpa, did you swallow a turkey or something? I mean, it's really, you know, kids sort of say the darndest things. So here's a guy who has really nice skin. So he didn't need any skin care, but he needed a little revolumization, muscle tightening, skin tightening, etc. See how let me back up. See if we go from there to there, he looks a little more revolumized, lift and fill. We don't, especially with men, we don't want to pull and stretch. Now, here's a gal who has profound, it looks like a lot of extra skin, but she has no extra fat. She's got a little bit of extra skin, but it's her muscle that's loose. Her platysma muscle is lax. And so she gets a platysmoplasty. That's the muscle underneath that gives those cords. Anybody ride horses? Some of you know what the platysma muscle is. In the horse, the huge jaw, the platysma runs from the jaw 3/4 of the way down the body, and that's how the horse shivers. For us, for our species, it stops at the clavicles, and it's like the appendix. It's kind of vestigial. It has no other function other than to give plastic surgeons work. So.
Is that skin, those two dark lines on her neck?
Yeah, that's partly skin and partly shadow.
So you pulled it up?
Yes, redraped it. And that's early. Usually those, see your incisions are a little red still. That's early. They tend to redistribute.
So is that considered a lift?
A neck lift. Yes. Surgical neck lift. With the platysmoplasty, the muscle was tightened up. Okay, so let me back up. Like 3 or 4 more minutes. Is that okay? So I've been talking about the triangle of beauty. That's on top of the foundation. Sometimes I go one layer deeper. So I've showed cases where I just treated the skin. I've showed cases where I just treated the fat, mostly the muscle, some combination. What about going one layer deeper? So here's a guy who's smart and has a great job. He said to me he felt in high school and college he never really had a defined chin and neck and jawline. So he got micro liposculpture, those 3 little incisions. Then I went inside the lower lip and brought the chin forward to do that. Hardly any scars on the little tiny scars on the outside. There's different ways we treat the chin. We can do fat grafting. I can bring it forward, and we can do a chin implant. Different ways that we talk about. So here's a gal, kind of a similar presentation. Reduce her nose a little bit, bring her chin forward, pick up the lateral brow, just more balanced. Much more sort of harmonious, balanced presentation. So with that in mind, I'm going to thank you for your time and attention. Justin, thank you so much. Kristen, thanks for coming. And appreciate everybody listening. Thank you. Thank you.